UHA, March of Dimes, teaming up to help pregnant women give birth to healthy babies. Now, Manola joins us with that from today's Catching the Wave to Better Health.
Well, November is Prematurity Awareness Month. Here are some things that you should know, or would like to know anyway. We have Dr. George McPheeters, USA Chief Medical Officer. Good morning to you.
Good morning.
Carmella Hernandez with March of Dimes Hawaii Chapter. Good morning to you.
Good morning.
Let's start with you a little bit, okay? Because there are some facts out there that are a little bit startling, I would say.
Yes, there are. Premature birth has been on the rise for over 20 years, and we have 500,000 babies being born premature in this country, almost 2,400 here in Hawaii. And a lot of times people think...
Every year, yeah.
Annually. And a lot of times people think, well, the baby's just small, but, that's not the case. The baby has a lot of health problems, underdeveloped lungs and underdeveloped brain. Just so many problems these little guys have, and they're fighting for their lives. And March of Dimes wants to find out what is the cause of so many babies being born premature and what we can do to prevent it so that more babies will be born on time and healthy.
And is it something, how do we find this out? Is it a matter of just sort of going through the process and having doctors report these incidents? Or?
Well, we have research. We spend a lot of money on research to find out the causes, and we have a lot of great doctors that work with us that are helping moms learn the things they can do that would help them have a healthier pregnancy, like don't smoke, don't drink, don't do drugs. Make sure you're having your prenatal care so your doctor is keeping a good track of of your pregnancy and making sure your pregnancy is healthy and you're healthy.
Okay. Speaking of great doctors, Dr. McPheeters over here. Well, I think she mentioned some of the problems that are happening, what's causing a lot of this. What else do women, or I guess everybody out there should know?
Well, moms at the extreme of ages, the young teenagers and then older moms have a greater risk. People who have had in vitro fertilization have a greater risk. But she's touched on the important ones, avoidance of drugs, alcohol, smoking, maintaining a normal blood pressure during your pregnancy, keeping a really close relationship with your obstetrician. Those are all really important. There are things that are beyond our control, and March of Dimes is looking to find out what some of those causes are. Ethnic differences, for example. Big differences between, say, the rate of prematurity in Scandinavia and the rate of prematurity in the United States. But it's a huge burden in terms of human suffering, not just as medicine has advanced, being able to see these preemies through the earliest times of life, later in life, trouble with their eyes and their lungs and all of those sorts of things. So the prevention is really critical at this point.
I know is it stress also is sort of, which when you're pregnant, I would imagine you're pretty stressed out, but try to avoid as much of it as you can.
I would say, well, I've avoided pregnancy to this point. Avoiding stress, living a very healthy lifestyle, and then those critical things, the avoidance of illicit drugs, alcohol, tobacco, maintaining a healthy blood pressure.
Okay, well, certainly, good pieces of advice right there. Thank you very much to both of you.
Thank you.
We'll be right back.